Growing up, my dad's pager went off almost every night.
Each call meant another patient's condition had escalated, a condition that could have been managed earlier. That question, why do preventable conditions turn into emergencies, led to LifeLine.
This is not a treatment failure, it's an access and monitoring gap. In rural America, residents live an average of 10.5 miles from the nearest hospital. In Texas, 22% of adults ages 19 through 64 are uninsured, and nearly 3 in 10 adults skip medication due to cost. Chronic disease progresses silently, unless it becomes acute. LifeLine is a low-cost preventative monitoring system, a simple hardware kit combined with an intuitive mobile app. It standardizes at-home tracking and flags early risk indicators before escalation. It shifts care from reactive to proactive.
Each Lifeline kit includes a blood pressure monitor, pulse oximeter, smart scale, glucose meter, a box of test strips, and printed onboarding materials. The retail cost per household for all these items would be $145 to $175, but with Lifeline and partnering with bulk manufacturers, we're able to bring that down to $70 to $90. We leverage FDA-cleared consumer devices, leading us to see no new hardware development.
The app is designed for low digital literacy. Features include real-time tracking dashboards, medication reminders, threshold alerts, secure clinician data sharing, and directory of free clinics. Importantly, 76% of adults earning under $30,000 annually own smartphones. Infrastructure exists, it's just underutilized.
Who do we serve? Well, our primary audience is underserved rural communities. These are categorized as areas with limited hospital access and a high lack of insurance. Our secondary audience is individuals at genetic risk. These are people who have family history of the conditions that we're hoping to monitor. We also plan to have institutional partners to help us distribute Lifeline, including rural clinics, nonprofits, and community health organizations. This includes places like the American Heart Association, as well as other national nonprofits.
To validate our idea, we surveyed 27 clinicians across 9 states. This included 19 MDs, 6 ODs, 1 MA, and 1 NRCMA. The majority rated structured home monitoring as highly impactful in improving chronic care management. There's provider demand for constant longitudinal data, and we're equipped to provide it.
Emergency alert systems are reactive. They respond after crisis occurs. Lifeline is preventative. We provide at-home monitoring, chronic tracking, and structured data sharing. We address root cause. One ER visit is exponentially more expensive than a Lifeline kit. In fact, one preventable ER visit can cost up to 27 times the price of one kit.
During our pilot phase, we plan to track 3 key performance indicators: the increase in consistent at-home monitoring, the improvement in medication adherence, and the reduction in preventable ER escalations.
Lifeline integrates with iOS and Android, uses FDA-cleared devices, is designed to align with HIPAA standards, and operates as a non-diagnostic monitoring tool. This reduces regulatory complexity and accelerates deployment. In phase 1, we're going to start deploying our kits in East Texas as well as partner with 2 to 3 local clinics. In year 2, we want to start expanding to additional 3 to 5 as well as securing institutional contracts. Finally, in phase 3, we want to start regional scale and multi-state.
Interview with Ashish Sethi, MD, MHA, and Chief Medical Officer. He stated that the most effective intervention is preventing the crisis before it begins. Right now, chronic disease burden is increasing, digital access is expanding, and cost pressures on emergency systems are rising. We built Lifeline on both national healthcare data and primary research, including insights from physicians, medical assistants, and rural providers. Prevention shouldn't depend on income, insurance, or zip code.
Lifeline exists to close that gap. Every life is worth a shot.
Choose Lifeline.